Hello everyone, I am Dr. Deepa. Today we are here to learn a new topic, that is median nerve in the hand. We study median nerve in the hand under the following headings, that is the course, branches, relations, distributions and the applied or the clinical importance of the nerve. To begin with, the course of the median nerve. As we all very well know that the median nerve is the main nerve supplying the anterior compartment of the forearm. This median nerve from the flexor portion of the forearm enters the palm by passing deep to the retinaculum over here, that is the flexor retinaculum above the wrist. So the median nerve is seen to enter the palm by passing deep to the flexor retinaculum, and it makes up the content of the carpal tunnel. So once it enters the palm by passing through the flexor retinaculum just along the distal border of the retinaculum over here, the nerve is seen to divide immediately into the lateral branch and the medial branch over here. So this is about the course of the nerve. Moving on to the branches of the median nerve, as we have just now seen that the median nerve enters the palm by passing deep to the flexor retinaculum. Now once the nerve enters the palm, the nerve divides into its two terminal branches, that is the lateral division and the medial division. So it divides into the lateral and the medial division. So before the median nerve divides into the lateral and the medial division, it gives one recurrent branch. Yes, the median nerve before dividing gives one recurrent branch. Yes, this recurrent branch tends to supply the thenar muscles of the palm. The recurrent branch supplies the three thenar muscles, which are the abductor and the flexor pollicis brevis and the opponens pollicis. So all these three thenar muscles are supplied by the recurrent branch of the median nerve, which is given immediately along the distal border of the flexor retinaculum. So once the recurrent branch is seen, later the median nerve divides into the lateral and the medial division. The fate of the lateral division is that it divides into three palmar digital branches. It divides into three palmar digital branches, the first, second and the third. It is dividing into its three palmar digital branches. The first and the second palmar digital branches supplies the entire thumb. It supplies the medial and lateral side of the thumb, whereas the third palmar digital branch tends to supply the radial side of the index finger. It supplies the radial side of the index finger. So this is about the distribution of the lateral division. So later the third digital branch also gives one branch to the first lumbrical muscle. So the branch to the first lumbrical muscle is seen to arise from the lateral division of the median nerve. So this is about the fate of the lateral division. Moving on to the medial division. The medial division later in the palm gives two common palmar digital branches. It gives two common palmar digital branches, the first and the second. The first later divides to supply the adjacent side. They later divide to supply the adjacent side of the index and the middle finger. It later divides to supply the adjacent side of the index and the middle finger. So this is about the first palmar digital branches, whereas the second palmar digital branches again divides in the same way. to supply the adjacent side of the middle and the ring finger, adjacent sides of the middle and the ring finger. So this is about the distribution of the medial division of the median nerve. So the first and the second division, other than giving the digital branches, they also give the branch to the lumbrical. So the first digital branch gives the branch, also gives branch to the second lumbrical muscle. So this is about, sometimes the second palmar digital branch is also seen to give branch to the third lumbrical, but usually the first and second lumbricals are supplied by the median nerve. So this is about the branches of the median nerve in the palm. I repeat, the median nerve in the palm, once it is seen entering the palm, it immediately divides into the lateral and the medial division. Before it gives division, it gives one recurrent branch supplying the thenar muscles. The lateral division later divides into three palmar digital branches, the first two of which supply the thumb. The third branch supplies the radial side or the lateral side of the index finger. The lateral division gives one branch to the first lumbrical. On the other hand, the medial division divides into the two palmar digital branches. The first one supplies the adjacent side of the index and the middle finger, whereas the second supplies the adjacent side of the middle and the ring finger. Later, the medial division is seen to give branch also to the second lumbrical as well. So this is about the branches of the median nerve in the palm. So this is the atlas view where we can see the same as explained previously. Now as we can see, this is your flexor retinaculum. We can make out the recurrent branch over here, which tends to supply the thenar muscles over here seen. Later, this median nerve divides into the digital branches, the palmar digital branches, the lateral division, the medial division. We can make out the lateral division supplying the entire thumb and the radial side or the lateral side of the index here. The medial division giving its two common digital branches supplying the middle and the medial side of the ring finger. So this is about the branches seen here. Again, the median nerve showing its distribution and the branches. The flexor retinaculum seen over here, the median nerve dividing into its lateral and the medial division. We can see the recurrent branch over here. We can also make out the branches of the lateral division supplying the thumb and the radial side of the index finger, whereas the ulnar side of the index finger and the adjacent sides of the middle and the ring finger is supplied by the medial branch, which is seen over here. So this is how the median nerve gives its branches and the distribution, as we can see over here. So next, moving on to the relations of the median nerve in the palm. As we have already come across, this median nerve tends to be related to the flexor retinaculum in its proximal aspect, whereas in its distal aspect, the median nerve along with its branches tend to lie deep to the palmar aponeurosis. So it lies deep to the palmar aponeurosis and it is seen resting on the interosseous muscle deep to it. So the median nerve is related superficially to the palmar aponeurosis as well as the superficial palmar arch and the long flexor tendons, whereas deep to the median nerve lies the interosseous muscles. So this is about the relations of the median nerve and its branches in the palm. When we learn about the area of distribution of the median nerve has the motor supply as well as the sensory supply. When we talk about the motor supply, the median nerve supplies 5 muscles. It supplies 5 muscles, which includes the 3 thenar and the 2 lumbrical muscle. The 3 thenar muscles are the abductor pollicis brevis, the flexor pollicis brevis, and the opponens pollicis. Along with these 3 thenar muscles, the first and the second lumbrical are supplied by the branches of the median nerve. When we look for the sensory supply of the median nerve, the median nerve supplies the lateral 3.5 fingers along with the adjacent palmar aspect. So this is about the sensory distribution of the median nerve along the palm. So the median nerve, so this here is the picture where we can make out the distribution of the median nerve. So in the palm, the lateral 3.5 fingers along with the adjacent portion of the palm is supplied by the median nerve. So this is the diagram showing the area of distribution of the median nerve over here. When we talk about the area of distribution of the median nerve over the dorsum of the hand, yes, the median nerve supplies the minimal portion along the dorsum of the hand, where we can see the yellow shade represents the area distributed by the median nerve, that is the the lateral 3.5 digits. The lateral 3.5 digit, the area of the skin adjoining the distal phalanx. So this is the area. So the fingers or the area of the cutaneous sensation adjacent to the distal phalanx are the area supplied giving the cutaneous sensation by the median nerve over its dorsum aspect of the hand. So this is about the distribution of the median nerve. This is again the picture area showing the distribution of the median nerve. So this is the picture of the palmar aspect of the hand showing the cutaneous sensation supplied by the median nerve. This is the dorsal aspect of the hand. As I have already told, the skin of the the lateral 3.5 fingers, which is supplied by the median nerve, that is the area adjoining the distal phalanx of the lateral 3.5 fingers. So this is about the distribution of the median nerve along the palmar aspect as well as the dorsal aspect of the hand. Lastly, moving on to the clinical importance or the applied anatomy of the median nerve, there are various aspects related to the median nerve like the ape thumb deformity, pointing index finger, the complete claw hand. The median nerve is very well known as the laborer's nerve, or it is also called as the eye nerve of the hand, as this median nerve supplies the muscles related to the thumb. So it is involved in the gross movements of the thumb. So major movement of the thumb is mainly involved by the median nerve. So as this muscle is involved in the gross muscular movements, it is called as the laborer's nerve as well. Ape thumb deformity, the condition wherein the person is unable to do the opposition action. So the opposition action of the thumb is completely lost. So this is about the ape thumb deformity. The other feature which is appreciated is that when during the injury of the median nerve, when the person is tried to close his fist. So when the person tries to close his fist, he is unable to do so, where the index finger is seen to be in the extended position leading to the pointing index finger. So this condition represents the injury of the median nerve, whereas in the complete claw hand is the condition wherein all the digits are extended at metacarpophalangeal joint and shows flexion at the interphalangeal joint. This complete claw hand involves all the digits which is involving the median nerve as well as the ulnar nerve. In case of partial claw hand, the ulnar nerve is involved, whereas in complete claw hand, we see the involvement of the entire median nerve. So these are certain clinical aspects in relation to the median nerve. So that's all about the median nerve. So we have studied about the course of the median nerve in the hand, the branches, distribution, the motor supply, the sensory supply, the relations, and lastly, the clinical importance of the median nerve in the hand. Thank you.